What screening guidelines apply to dense breasts? Imagine your breasts as a mix of fatty tissue and fibrous or glandular tissue. When there's more fibrous tissue compared to fat, we call that dense breast tissue. About half of women of screening age have dense breasts, which can make detecting cancer more challenging on mammograms. That's why understanding the screening guidelines for dense breasts is so important for early detection and peace of mind. Current guidelines recommend that women with dense breasts start annual mammograms by age 40. This early and regular screening helps catch any abnormalities sooner. The National Comprehensive Cancer Network suggests women with dense breasts see their healthcare provider every 6 to 12 months for breast health checks. The U.S. Preventive Services Task Force recommends mammography every 2 years for women aged 40 to 74, but they note that evidence is limited about whether additional screening methods are needed specifically because of breast density. Because dense tissue can hide tumors on standard mammograms, supplemental imaging is often advised, especially for women with extremely dense breasts. For these women, starting at age 50, or earlier if they have other risk factors like family history or genetic predisposition, additional screening with breast magnetic resonance imaging is recommended. Some women may consider starting this screening at age 40 if their personal risk is higher. Besides MRI, ultrasound and newer techniques like contrast-enhanced mammography can also improve cancer detection in dense tissue. In September 2020, for new regulations in the United States requiring mammogram reports to include breast density information. Patients are now notified if they have dense breasts, which can mask cancers and increase risk. This transparency encourages women to discuss their individual screening plans with their healthcare providers, taking into account their breast density and overall risk factors. Risk assessment is a key part of personalized screening. Women with dense breasts should evaluate their family history, genetic factors, and other risk factors with their doctors. Those at higher risk might need to start supplemental imaging earlier or have more frequent screenings. It's important to remember that each woman's situation is unique, and screening strategies should be tailored accordingly. In summary, women with dense breasts should begin regular mammograms by age 40 and consider additional imaging options like magnetic resonance imaging, ultrasound, or contrast-enhanced mammography, especially if their breasts are extremely dense or they have other risk factors. Open communication with healthcare providers about breast density and personal risk helps ensure the most effective early detection plan. Always consult your doctor for personalized advice, as screening recommendations can vary based on individual health history and risk factors.